Centers for Disease Control and Prevention. Kelly Jackson, one of the biggest problems going is the over-prescription of antibiotics, as well as handing out the wrong antibiotics. There is a St. Louis company that is hoping to change that. Among their prizes has been the Olin Cup at Washington University, as well as an Arch Grant recipient from Nanopore Diagnostics. Tom Cohen, welcome to Big 550 KTRS.
Thank you. Thank you, McGraw and Kelly, for the opportunity to tell our story a little bit.
How bad of a problem is the over-prescription of antibiotics?
A major issue. It's a legitimate epidemic in the healthcare system. You know, as the numbers you were spitting out, 50% of all antibiotic courses we've taken in our lifetimes were not handed out properly. And we believe it's not a case of physician incompetence. The problem really is a lack of adequate testing strategies.
And the problem is that doctors don't know which one to give, so they give all of them, or a wide variety of them.
Yeah, or give them when they're not even needed.
Right.
And because current tests take so long, they have to act without any definitive diagnostic information.
And how does Nanopore Diagnostics going to change that?
Yeah, so we're developing a test that can diagnose an infection in 30 minutes right at the point of care, enabling physicians, particularly in hospital settings, to wait till they have definitive information before they make the antibiotic decision.
And so you see a world where the doctor would administer this test, and like the bat machine, it would spit out the right antibiotic?
Yes, exactly. Yeah, information that would allow them to make that decision.
Right.
Yeah.
How would they administer this test? Is it a blood test?
Yeah, yeah, exactly. So it would depend on the sample type in question, but the first product that we're developing would be a blood test.
A blood test.
Yeah.
So the doctor would take your blood, put it into this machine, and it would come back with whatever the antibiotic would be.
Yes, whatever bacteria happens to be there.
Yeah.
Would it be expensive?
Yeah, that's a good question. So that offering would be a $140 test. But the people we're talking about treating there, people that are septic, people that actually have bacteria in their blood, are deathly ill and actually are the most expensive condition treated in U.S. hospitals today. And so it's not adding that much cost to what it is already.
So it would save, the net benefit would be saving money.
Yes, getting patients out of the hospital quicker. They cost about $5,000 per day.
Now you won these Arch Grants and you won the Olin Cup. How far along are you in the testing? Have you shown that you can do this, or is this science fiction?
We've shown we can do it. We haven't done a real clinical study yet, and we've taken 50 patient samples. We have a partner lined up at WashU to do that, and we're raising the money right now that's going to fund that initial clinical
Gotcha.
work.
When do you suspect, assuming there's a lot of hurdles to go through,
yes,
but when do you expect this to be a product that we would see in the doctor's office?
About 4 years.
4 years.
Yes.
And so what's the next big hurdle you have to pass?
Getting that clinical data back in a large enough sample size where we can demonstrate the accuracy and sensitivity required. And then the next piece is actually building the commercial product. Right now we have a lab prototype. And so we need to now turn that into something that can actually have a box put around it and be sold to a hospital.
You have to feel pretty good to be raising money and to be talking about this and to winning all these prizes. So the technology you must feel pretty good about.
That's really where this started. Me and my co-founder had read about the technology. It's from the University of Missouri, actually. So I was a researcher at WashU, and we thought the technology was incredibly innovative, and we built this offering around the technology. But really, at the bones of our company is a really innovative technology platform.
And so
yes.
you read about the technology,
yes,
and said maybe this could work for antibiotics.
Yes.
Are you hearing anything back from the medical world?
So there's a strong need for this. Anyone we talk to who's interested, they also want to see the data that I've said we're about to produce.
Right. Now all right, so now you're in the seed part of this. Talk about this for a second.
Yeah. So, we raised what we're calling a pre-seed round last December. Right now, raising a seed round focused on the initial clinical data and building a prototype. The next round after we have that would be the round where venture capitalists come involved, and we really start to grow.
Because it's not that much money. The first one was $500,000.
Yes.
And this next one's $1 million.
Yes. Yeah.
Now, to you and me, that's a lot of money. But in terms of bringing something to market, those seem to be pretty
Yeah,
pretty small amounts.
They're smaller chunks, and that's done because of how much our company is worth right now. If we can postpone raising the larger money as long as possible, we retain more of the company.
When do you expect this first clinical data to sort of come out?
We're hoping to have it in the spring.
In the spring. Yeah. So you're in the middle of this critical data right now?
Yes.
So you're in the process of gathering all this information. So far, so good with the numbers?
Yes.
Pretty excited about it?
Everything looks promising. There's been no worries.
Where do you see other technologies like this sort of manifesting itself?
Yeah, there is a ton of competition in this space because it is such a large issue. So there's definitely plenty of people going after it. And there's a number of different ways you could do that. In terms of other technologies like the one we have, other nanopore-based platforms, they're primarily being used in clinical sequencing related to cancer detection and choosing the appropriate therapy for a particular cancer. So that is really the hottest area for.
That's really interesting. So, but through your blood, it would be able to detect what antibiotic would work best.
Yeah, look for pieces of DNA or RNA specific to certain kinds of bacteria that might be there.
Right.
Wow.
It's really science fiction when you get right down to it, isn't it?
Yeah, it was when we first started doing this, it was a pretty crazy idea.
Yeah, and it was originally invented. The University of Missouri invented this.
Yes.
Some student or some doctor,
a professor there. Yes.
Professor there.
Yep.
Pretty interesting stuff. Tom Cohen with Nanopore Diagnostics. Where can people go to find out more information?
We're online at www.nanoporedx.com and on Twitter at Nanopore DX.
Tom Cohen, when you hit it big, will you mention us as one of your early supporters?
Sounds good.
All right, good. Tom, thanks for coming in.
Okay, thanks, guys.
8:23 here, Big 550 KT.